Now, we've just gone from the anecdote of an individual patient. Let's talk about a study. Kaiser Family Foundation, a little bit of a left-of-center group, but a good group, did a study where they compared the cost for a family of four, which had a health savings account with a catastrophic policy on top. So if they had a terrible illness like a liver transplant that exceeded the amount of money in their account, the catastrophic policy picks it up on the top end. They compared it with the cost of a traditional insurance policy for a family of four. They found that the family of four with the HSA, the health savings account, and the catastrophic policy on top, they found that that family's cost of that HSA and catastrophic policy was 30% cheaper than the cost of the traditional insurance policy for a family of four. And they found that both families use preventive services as frequently. So what we have here, if our goals of health care reform are to control cost, to expand access to quality care, by lowering premiums, so the Kaiser Family Foundation found that the family with the HSA and catastrophic policy, their policy costs were 30% cheaper compared to traditional insurance. They also found that 27% of those people who had an HSA and a catastrophic policy were previously uninsured. That 50% of people with these sorts of policies had family incomes of $50,000 or less, and that about 60% of such families had family incomes of $70,000 or less. So, by controlling cost, the HSA catastrophic policy 30% cheaper, by controlling cost, those people who were previously uninsured, 27% of the folks with these HSAs were previously uninsured, were able to now purchase insurance, and with this insurance, they access preventive services as frequently as those with traditional policies. So the goals of reform were achieved. Lowered cost, expanded access to quality care. Now, I've been joined by my friend